Deep in the heart of the Surrey countryside lies an extraordinary vet's practice.
OK, let's go. Right, straight into number 1. We're going to theatre. Let's go. All hands on deck. Clip this leg.
Here, the hardest-to-treat pets from across Britain
Ooh, ow, 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 ow,
are given some of the most advanced procedures available anywhere in the country.
I got it. Various pieces fit together to build a new endoskeleton, a bit like the Terminator.
The practice is the brainchild of one man, Noel Fitzpatrick.
All right, Bumble, let's give it a go. Oh, that's nice. Hey!
Known as the bionic vet, Noel has invented countless operations to help heal sick animals.
Some people come and they expect you to work a miracle.
Please do what you can.
But most people come full of hope. Come on, able to walk within 48 hours.
Fitzpatrick Referrals, Natalie speaking. Can I help?
Every week, around 80 dogs are referred to Fitzpatrick's.
We get so many different breeds. Big doggies, small doggies.
Short-legged, tall-legged, curly hair, short hair, wiry hair.
Some doggies can look over the reception desk.
Hello, gorgeous. Hello.
Some can get placed on top of the reception desk.
Go on, get her, quick.
No, it's not a monster.
I've probably seen most shapes and sizes of dog in my life, but I still get surprised. You know, we see sometimes dogs that I have never seen before.
So sometimes something comes in and you have to quickly Google what they are.
You can never really predict what your day's going to bring. Just depends on what reception decides to give you.
It's mid-morning, and Cyrus, a rare type of bulldog, has come into the practice with his brother Bruce and owners Amin and Minu.
They're Alapaha Blue Blood Bulldogs. They're very unique dogs. We're originally from Iran. Been here since 2001.
I've been here just 2 years. Yeah. I'm telling you, they're my friend. I'm kind of alone here, and they're best friends for me.
Now, Cyrus, please, Cyrus.
1-year-old Cyrus has been referred by his local vet after he started showing signs of pain in his right knee.
Hi, guys. Hello. Hello. Hi. Hello. Hi. Nice to see you. If you're OK with it, I would suggest you take them off the lead, just so that they get a little more comfortable and don't feel threatened.
Yes.
So I would just like them to see whether I'm a good guy or not, and they can make up their own minds. They will make up their own minds, by the way. You see, they're still not quite sure because they know they're in a strange environment. OK, what did you notice? A lameness?
Comes out in the morning and is holding the right leg up out of nowhere.
The right hind leg was just up.
He was just jumping on the back leg, and the left knee went last week.
OK. And is the other dog affected at all?
No.
What's his name, the other dog?
Bruce.
Bruce?
Yeah, B-R-U-S.
Was there a reason you said Bruce and Cyrus? What's the history with the names?
We brought this one, so okay, rhymes with Bruce, Cyrus, Bruce.
It doesn't rhyme.
It doesn't rhyme. It goes with it.
Cyrus does not rhyme with Bruce.
No, it doesn't really rhyme, but it goes. Bruce, Cyrus. I do a bit of music myself, Persian hip hop.
Really?
Yeah.
I've never even heard Persian hip hop.
I'm not saying the best Persian rapper, but I'm the best Persian rapper in the UK.
I love it. It's like I'm not gonna say I'm the best, but I'm the best. I'll get my assistant and we'll examine the knees. Can I have an extremely strong man? No. All right, big guy. There we go. All right, good. So if you hold the head for me, buddy. Good boy.
Bruce. Good boy, Bruce.
Okay. So right, guys, right here I'm holding the thigh bone, and right here I'm holding the shin bone.
Yeah.
And it does rock like that. It shouldn't rock. It's loose.
Oh.
That means that one of the ligaments inside there is ruptured. Let's check the other one. So, see that? So that one's ruptured as well.
Yeah.
The ligament that's gone is this one in here.
Oh.
And as a result, That one can go like that, okay?
The X-rays taken by Cyrus's local vet have revealed another issue which is adding to his problems.
There's a hole inside the joint that is caused by a genetic problem called OCD.
Okay.
That's not obsessive-compulsive disorder. It's osteochondritis dissecans, which is a medical term meaning cartilage doesn't develop properly. It's a genetic defect. So we got to take out the dead cartilage and we got to fill that hole with something.
All right.
So this is the implant. If there's a hole here, we would drill it out, pop that fella in, and that fella would form the new surface of the joint.
Okay.
From a medical point of view and from a moral point of view, I would not put this dog through surgery on one knee without doing the other.
Yeah.
I wouldn't want to put him through any surgery at all unless I'm going to fix him.
Yeah.
So that he can have a happy life.
At first, you can't think straight.
Yeah.
You can't really think about any of it.
It's a lot to take in for Amin and Minu, who need time to consider their next step.
Cyrus, come on.
The state-of-the-art hydrotherapy centre at Fitzpatrick's is an integral part of rehabilitation for many of the patients, no matter what their breed or size. Some need only a few sessions.
Come on, buddy. That's it. You can do it.
But others require more long-term treatment. One of the regulars is 6-year-old Newfoundland Bucklesbury Bear, who was diagnosed with bone cancer in his leg 9 months ago.
It was just, we were so shocked.
It is the I've been punched in the face.
It just punches you.
And we asked the question, it's always unfair to ask a vet, if it was yours, what would you do? And I'll never forget his words ever.
I'd give the fella a chance.
That's a very bad Irish accent. You know,
The cancer had progressed so far that Noel had to amputate his entire front right leg and shoulder. Amputating a leg in an 80-kilogram dog was a major decision for owners Hugh and Sarah. No one knew for sure if Bucklesbury's remaining front leg could bear the weight.
We were going to go and see him after the operation and everything else. And when he was brought in, I honestly wobbled. I really thought I was going to faint. We hadn't got a clue how he was going to cope or anything else. But he's so brave. I mean, his spirit is just massive.
Yeah, whoa!
Looking after Bucklesbury is a demanding job, and the house in Tunbridge Wells has had to be adapted.
Well, it didn't come with a book of instructions, so we've literally had to make it up as we go along. We've had to strategically put rugs and mats in places so he doesn't slip or slide away.
It's got to be covered.
It's got to be covered. It's just
you can't fall. He couldn't fall on that. That would really hurt him. So you put those down.
Today, this three-legged giant is off to one of his regular hydrotherapy appointments.
What he's found that makes him perfectly normal is swimming.
That's what makes him complete, because when he's in the water, he doesn't know he's got 3 legs.
You know, he'd swim the channel if he could.
Weekly hydro sessions help build strength in Bucklesbury's remaining 3 legs. Being such a heavy dog, he struggles to get enough exercise on land. But in the water, it's another story.
When Buck comes in for hydro, you know, he goes back to his breed. He's a Newfoundland, he's made for swimming. They've got webbed feet. I think a trained Newfoundland can pull something like 10 grown men in a boat. They're not really fast, but they can go on and on and on. They're just built for power.
They're one of the few dogs that swims like a polar bear. It digs the water out and kicks with their back legs and that sort of thing.
He cheers me up every week when you see him because, you know, he doesn't care. He just gets on with it, and that's what I love about him. He is a big dog, and probably was a risk for the owners to take his leg off. But you know what? They did it. They gave him a chance, and you look at him now, You wouldn't question it. He's just an amazing dog.
Despite his progress, Hugh and Sarah have to be constantly on the lookout for any signs that the cancer has returned.
There's every chance that the smaller, the seedlings, the tiny cancer buggers are still in the bloodstream, but you're just hoping that it won't come back just yet.
You know, borrowed time or not, he's just every day is, well, it's just worth it. You know, he is a member of our family, and
Buck.
He's Buck, Lord Bucklesbury Bear. Swimming him in hits.
Coming through.
Cyrus, the blue blood bulldog, is back at the practice. A genetic disorder means his back legs are lame, and following Noel's advice, owners Amin and Minu have decided to investigate further before committing Cyrus to surgery.
So cute.
I specifically asked Noel, I said, I need to know if he has any other issues with any other joints. Because it's not fair on the dog to obviously do 2 operations on the back leg, and 6 months later you gotta do more operations. Then there's no point.
CT scans of all 4 legs reveal the true extent of his problems.
It's not looking good for Cyrus. Basically, he's got problems in both knees and both elbows. And I'm about to make a phone call that's a life or death situation. Oh, hi, buddy, it's Noel here. I've just got all the images in and I just wanted to talk to you. The elbows are affected to some extent, not by the same condition, but by a different condition called elbow dysplasia, which has some fragments in the joint as a result of the elbow not fitting together exactly right.
When he said that, I was like, all right, it's just, there's no point. I needed Noel to give me the confidence. I was like, you know what you're doing, you're the surgeon. You tell me if it's worth it.
It's not my dog, but if I were in your position, I would feel like you'd do really torn about what best to do because all 4 joints need treatment. That leaves us with the life or death situation for him of do we proceed or not proceed? Is it morally right to put this dog through the surgery?
It's evening at the practice, and Cyrus, the blue blood bulldog's future remains uncertain. He's still sedated from his scans, and if his owners decide to operate, it'll happen straight away.
So he's going to talk to his wife. It is a life or death situation. Either we treat all of these joints now and do our best, or he's going to be in pain and we'll end up putting him to sleep.
Whatever happens, I'll have to do what's best for him. And that's what loyalty is. You gotta be loyal with, even if it's your family, your friend, or your dog. So.
My gut feel is that I'll be able to provide a good quality of life for at least the next few years, and he may need medication later in life.
We did think about putting the dog down. And then I said, I just can't do it.
Right, guys, this dog is going to be operated on all 4 joints. Let's go. Both elbows and both knees. Clip him. Okay, so once again, we're burning the midnight oil. It's 20 to 10. We're going to cut both knees first, and then we're going to do both elbows. Oh, I'm so tired.
Operating on all 4 legs means it's going to be a long night ahead for Noel and his team.
Under normal circumstances, we would hardly ever have a situation where we would operate on all 4 legs at the same time. But in the case of Cyrus, we felt it was in his best interest because although the back legs needed quite significant surgery, the front legs could be done with keyhole surgery, which he could easily get over. Ladies, can we plug in the scope, please?
Noel starts by inserting a high-tech miniature camera inside the left knee to magnify what's going on inside the joint.
Okay, so we can see here the fronds of the ruptured ligament. It's like the ends of a torn shoelace. What we're going to do first is we're going to cut that ligament out using what we call a joint lawnmower. You can see it's got teeth on it like a lawnmower. It sucks up those little pieces of tissue and munches them up. Like cutting the grass on your lawn. Good. So if we look closer into the joint, we can see the area of damaged cartilage. And as we scrape it away, you can see the bone underneath is red raw. Now, if we leave that alone, a big hole will form here. And that will be a major problem for the joint.
Next, Noel uses a special drill to make a hole into which the implant will sit.
This is the implant. On the bottom part of the implant here, you can see the plastic surface, and that's going to replace the cartilage. There's no room for error at all. It's absolute precision or it's a disaster.
With the implant securely in place, Noel now has to reshape the knee joint by cutting and rotating the top of the shin bone.
Because the ligament was ruptured inside the knee, the thigh bone was slipping down the slope of the shin bone every time Cyrus walked.
Now Noel has to hold the newly aligned knee in place with pins, plates and screws.
Hold it. Okay, let's do the other knee. We're here just in time. We might get away without putting in a plastic cap here. That's very good news. So we just need to reshape the knee. You'd never know what happened under there, would you? A few stitches disguises everything. All right, let's get these elbows done. 2 down, 2 to go.
It's gone midnight as Noel tackles Cyrus's elbows, which he does using keyhole surgery through 2 tiny holes.
There's a piece of bone broken off right there. We need to get this fragment out, and we also need to take off this damaged piece of cartilage and bone. Nice. Do it. We're going to go inside the joint and grab it and pull it out like you would on a computer game. Do the death roll for the fragment, detach it, and then pull it out. There we go. That's the culprit right there. One last stitch and we're done. Okay, let's get out of here. Thanks.
After 3.5 hours, the operation on all 4 legs is finally over.
Oh man, nearly 2 a.m.
Before it can be hailed a success, Noel must review the post-op x-rays.
On the left knee, you can see here where we put the cartilage replacement plug in, and we can see that what we've done is we've leveled off the top of the shin bone so the femur doesn't slip down the slope anymore. It used to be there, now it's there.
Hello?
Hey buddy, it's Noel.
Hi, Noel.
I'm so sorry it's so late. It's just, you know, it took as long as it took.
Yeah.
I finished all the operations and they went well.
Fantastic.
So all in all, a good night's work. And I'm happy with the way things went.
All right, fantastic.
All right, buddy.
100%.
I'll talk to you tomorrow.
Have a great night.
Take care. Bye-bye. He's probably used to being up this time of the night, out clubbing. You know, I'm glad we did it. I think it was the right thing to do for Cyrus. And the difficulty for me, now that everything is possible, is knowing when to draw the line, you know? When is it not right? When is it not morally right? And that's the line in the sand now. It's a line of what's morally right for that dog or that cat at that moment in time. And every dog's different, every scenario's different. And in this case, I'm absolutely convinced we did the right thing.
It's 10:30 in the morning. Waiting in reception are Hannah and Rich with their crossbreed, Ghost, an Alsatian Husky puppy.
Such a cutie, aren't you?
His arrival 7 months ago was a bit of a surprise for Hannah.
Basically, Richard mentioned about getting a dog, and I was like, maybe later on, once we sorted ourselves out and things. And then he went out with a friend on a Sunday and came back with Ghost.
I went to drop off a bike and came back with a dog.
So a bit of a shock to the system, like, oh my gosh, what do I do? But yeah, you could not fall in love with him really, so. Oh, more our baby, isn't he?
Yeah.
Hello, Nolly. Ghost's here it's 10:30. Yeah.
Should give your leg a run.
The couple were referred after Ghost developed an intermittent limp in his front right leg.
You're gonna go right up to the top of that car. You're gonna walk back down straight towards me. So that's the thing with lameness in puppies. That's great. It only happens from time to time, so everything's really subtle. It's like the smallest, tiniest change. Okay, let's do the physical. Okie doke. Any part of the leg can cause a lameness, so you always start at the bottom and work up.
He's a good boy.
It's not so bad. It will be in a minute. If it is what I think it is, hold tight.
Oh, good boy, good boy.
Doesn't like that. Okay, and that's the non-lame leg.
Oh, is it?
Yeah. Okay, if you go the other side for me.
Good boy.
Okay, this one will be even worse, probably.
Yeah, go on, it's all right, it's all right, it's all right.
Yeah, it doesn't like that. That really hurts.
It's hard, obviously, with knowing that he's been in pain.
Not having had pets and not really knowing what to expect, and suddenly your heartstrings are being pulled a little bit.
All right, let's go back in.
Okay. I couldn't be without Ghost at all. Doesn't matter what it is, I just want him to get better.
Come on, buddy. He's lame on both front legs, but it's very difficult for you to notice that. There are a few conditions that dogs will grow out of, one of which is panosteitis, and that's an inflammation of bone marrow. You should hope it's that. But frankly, I don't think it is. Because when I moved the elbow up here and then like that, what I was doing was driving the inside of the elbow against each other. Now, what that means is that this bone doesn't fit in the saddle properly. And over time, what can happen, you can get a load of cracking occurring under the surface, a bit like an earthquake, because this is being driven up against that. If it looks like really we have a poor fit, then I'm gonna have to cut this bone and drop it down a bit.
Bit of a shock. Obviously, we weren't expecting any of this. To find out he's semi-lame in both front legs is, it's massive, really.
Noel needs to do further tests on Ghost to see if he really will need corrective surgery.
Leave him with me. Go and do what you need to do. I will ring you, I'll tell you what we find, and then you can decide what you want me to do. Good man. All right, I'll see you later.
All right,
thanks,
see you
guys.
later. Cheers.
All right, cheers.
Rich and Hannah are going home without Ghost and must now wait to find out the results.
Oh my God, I can't keep it together.
Nobody wants their dog to go through surgery.
Try not to worry.
Thank you.
Dogs can usually cope, but people find it really, really difficult because they want their dog to be a puppy and run around. And sometimes that just isn't possible. And it can be harder for the people than it is for the puppy.
I never thought a dog would make me cry so much.
Yeah. Yeah, you just have a bad day and you come home and, yeah. I feel ridiculous now.
I'm sure we'll be all right. Yeah.
Bonnie, incy wincy spider, climbed up the water spout.
Back home in Farnborough, it's been a difficult time for Cyrus's owners, Amin and Minu, but especially for Cyrus's brother, Bruce.
Bruce, he was very depressed, didn't eat for 2 days. He was a totally different personality, totally different dog.
all the time stayed in the kitchen, you know, lying in front of the door.
Finally, after operations on all 4 legs, Cyrus is well enough to go home.
All right, buddy. There we go.
Whiskey little.
I was ready to actually like try to lift him, bring him out, but he was walking on his own, and it actually surprised me.
And that's fine. Come on, buddy.
Come on,
Hey, buddy.
Come
Come on, bud. Just walk down along there for me so that I can see you do it. There we go. I'm just really pleased that we could get all 4 joints done, and I think he's got a good prognosis now. You know, if we can get him through the next 6 weeks, he should do really well.
We really appreciate it. I don't know
No
how
worries.
to say thank you.
No, it's my pleasure.
It will take months of care and attention before Cyrus is back to full health. Technology plays a massive part in the Fitzpatrick practice. But all the scans in the world are useless unless you know what you're looking for.
That's really seriously cool.
Claire Rusbridge is their head of neurology and a pioneer in her field.
Sedative works better with cuddles, yes. The thing about neurology is that you have to be a bit of a detective. You get certain signs which will suggest disease in certain places. Are the scans good? Absolutely. Don't you? Oh, fantastic. And so you have to take the clues and then do a further investigation to get your answer. He is clear of syringomyelia. Good, 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 good.
All right, baby, come on.
Diane and son Rhys have rushed in to see Claire with their Bichon Frise Cross Maltese Terrier, 5-year-old Bella.
All right, come on.
She's been diagnosed by her local vet with a suspected disease called syringomyelia.
Seeing your dog that sick is awful. Absolutely awful.
All right.
She was going downhill fast.
Bella?
Bella's condition has deteriorated dramatically in the last 24 hours.
Pleased to meet you.
Hi, nice to meet you too.
All right. Shh. Come on.
Right, you can just let Bella have a wee run around. Tell me about Bella.
It started off with ear scratching. She started to have a lot of shivering. Then the pain started. And the other day she wasn't like this. There we go.
Okay, Bella. I know, like, I'm doing, like, weird stuff to her, but really, these are all tests for balance. Her eye is not keeping the same position as her left, which is telling me that she has a balance problem. These signs would be highly, highly unusual for syringomyelia. And I think her signs fit far more, unfortunately, with having something wrong with her brain. In particular, I think she may have a disease called granulomatous meningoencephalomyelitis, or GME for short. It's not a nice disease to have. Her immune system is destroying her brain. It's often a killer.
Bella will need to undergo a delicate procedure to confirm it is GME.
The normal way that it's diagnosed is by taking a small sample of fluid from the back, which is called a lumbar puncture. But there is, unfortunately, a risk of death under the procedure because the brain is swollen. When we actually put the needle in, it causes a sudden release of pressure.
The disease can only be treated using intensive drug therapy.
Treatment is chemotherapy, like for cancer. That's how serious this is.
What's the success rate?
It's about 50%.
But now through all of that, nothing. That's what worries me. I just don't know what to do for the best.
I know that you love her, but nobody is going to be critical of you if you just said, actually, you know, her prognosis is not good. It's time to to call it a day now.
Well, as long as those Bella's not going to suffer too much, give it a go.
If she dies, it may be a better release for her because she wasn't going to make it. Okie dokie, right, little squish. Aww. Let's just say goodbye to Mummy.
I love you. Good girl. Be a good girl.
Kim, this dog is really, really sick. I'd like it to be bumped up the MRI queue if it can. We need to do a CSF tap as a priority. Bella.
I know, baby. You're okay. It's just awful. Just want to see her back to normal.
She can go downhill extremely rapidly from now. If we did nothing, she'd probably die in a few days.
It's okay.
This dog is very sick indeed, unfortunately.
Bella, the Bichon Maltese cross, is about to be tested for a life-threatening brain disease known as GME.
You need to push her hips and her shoulders together.
A sample of spinal fluid is urgently required to confirm Claire's diagnosis.
This is a risky procedure, and it could result in the death of the dog, but sometimes we have to do tests that carry some risk to get the answers that we need. She's quite small, so this might be tricky, but hopefully. Lumbar puncture is normally a low-risk procedure. It was higher risk in Bella's case because she had increased pressure in her head. That was dry. Can someone get me another small black spinal needle, please? Quite simply, putting the needle in can be a little bit like deflating a balloon. By suddenly releasing that pressure, you can cause damage to the brain. Oh, we are in, though. They can die from it, basically. If it's going to happen, she would have died already. But I think we're going to be all right now. So that is abnormal CSF. OK, I think we'll do it at that. So she can wake up, she can be reversed.
Tests on the spinal fluid immediately reveal Bella does have GME.
So now we have a diagnosis.
If left untreated, the condition could kill Bella within days. An intensive course of chemotherapy and steroids is her only chance of survival.
Very worried, aren't you?
Very worried. I am careful not to get my hopes up when a patient starts chemotherapy because it can come with a lot of side effects. It can be quite intense as well and very demanding on the owner and on the dog.
So now I'm going to give the chemo to Bella. Oh, you're going to run away from me. Come on, darling.
The drugs are the same as in human cancer treatment.
She's such a good girl.
A much lower dose is given initially to try and minimize side effects.
Run over there.
The aim is to reduce the inflammation in Bella's brain.
She'll have to have that another 3 times. Then in 3 weeks, she'll have the same. And then in 4 weeks, the same. And she'll go on and on at the dosages that Claire wants. You know, and hopefully we'll see some improvement in her clinical signs.
Noel's ready to conduct tests on 7-month-old Ghost, who is lame on his front legs.
So we're going to take Ghost up to the first plate room. His lameness is very subtle, difficult to see, but the computer will help us to determine which leg is most lame. So we're going to walk him across this plate. The computer will tell us how lame or otherwise he is. Okay. Right, let's do it. Good boy, you could not get a better dog.
A dog of Ghost's weight should be exerting 180 points of pressure on each leg.
So we've walked him across the first plate 7 times. On average, the left front readings were 137 and the right front readings were 158. So that's surprising, because his mum and dad thought that he was lame on his right front leg, and it turns out he's more lame on his left front leg. Just goes to show you how your eyes can play tricks on you. All right, let's go. All righty, thanks a lot.
Well, if we put the IV in and then we can start it off for you, yeah?
Scans will reveal if Ghost needs surgery or if he has a less serious condition that he will simply grow out of.
Okay, we're ready. Great.
The technology now with X-ray, MRI, CT has revolutionized diagnostics and really can give us some definitive answers as to what we should be doing.
X-ray. That's better. Perfect. Yeah.
So we can see it here on the X-ray picture. Shouldn't have this big patch. It's like a thumbprint on the bone. That right there.
Noel now has the results Ghost's owners have been waiting for.
Hello?
Hi, is that Hannah?
Yes, hi.
Hey, Hannah, it's Noel. Listen, I've got news for you.
All right.
What it is good news. Turns out that it is this inflammation of the bone marrow that I was telling you about, and it's not a poor fit of the elbow.
Yeah, that is so good. God bless him.
All you need to do is give painkillers and it will go away.
Oh, that is brilliant.
Yeah, so this is excellent news.
That's so good to hear. Thank you so much.
All right, darling, no problem.
All right, then.
Take
See you
care.
soon. Take care.
Bye. That's unusual. I normally am ringing people up to give them bad news or to give them mediocre news, but today, happy news.
Just a few hours later...
Now, Ghost, please.
Hannah and Rich are back to take Ghost home.
Nice to see you smile. How are you?
Hi,
Nice
you
to
right?
see you smile. You all right? Good, good. So, yes, good news. It is the inflammation of the bone marrow. I've never seen it not resolve.
Okay.
And it should go by the time he's a year of age.
Yeah.
Happy days. We'll bring him in. Come on, mate. There we go. Hi, hi, you see? See, hi.
Hello.
Oh, there we are. There we are.
So happy. Can't really describe it.
Relieved, massively.
When you phoned, my heart was in my mouth. I just expected the worst. And when he said, so it's a good scenario, I was like, oh my God.
Goodbye, mate. Hopefully I'll never need to see you again. Go and have a happy life.
I think I'll sleep for a week now, so that'd be nice.
With him lying all over your legs.
Yeah, exactly.
No bionic legs for him yet.
Yeah.
It's been 48 hours since Bella had the first course of chemotherapy for the brain disease GME.
Hello. Hello. Wow. Wow, we can walk. We can walk. This is good. She's looking great. She is now more upright. Her head's in a normal position, which is always a good thing. She's much better able to walk and she's much more lucid. We wouldn't normally expect such a rapid response.
The initial treatment has saved Bella's life.
You're so cute.
Bella?
She's now well enough to be reunited with her owner, Diane, and her son, Reese.
When we went back to the practice, she just looked so much better. That's when we had hope.
Well, she's wagging her tail.
So relieved I was taking out a different dog.
Massive difference from the other day. Oh, and she's not crying.
One thing that being a neurologist has taught me, that sometimes when they look really, really awful, it's possible to do something.
Do you want to go home?
You live for the cases that you can go home at the end of the day and say, that went well.
Here's a good girl.
Despite a positive start, Bella will still need months of medication.
Good girl. She's thinking, come on, let's get home.
It's now 14 months since 6-year-old Bucklesbury Bear had his front leg amputated due to osteosarcoma, a type of bone cancer.
Oh, bless him.
This is back when he was fit with 4 paws.
It's a different life. It was much easier, wasn't it?
Some photographs with him and his adult with 4 legs. It just suddenly jolts back. Oh, blimey, yes, he used to have 4 legs.
It does make you sad.
Hugh and Sarah are taking Bucklesbury back to Fitzpatrick's for a checkup, as he's developed a worrying new symptom.
He's just had this bit of a grunt, and we really don't know what it is. I mean, it could be the cancer coming back. I hope not, obviously.
They're seeing veterinary surgeon Tim Sparrow.
There's a very high risk of recurrence with osteosarcoma. The average survival time is about 12 months, and that's recurrence of the tumour elsewhere in the body, usually within the chest, within the lungs.
That's a good boy. Come on. Come on, there's a good boy.
I'm just reviewing the CT scan of Bucklesbury Bear from the 5th of November. At that stage, the chest was clear.
Hello there.
How are you?
Good.
Right, come on in.
Yeah, fantastic.
You go in first. Let's just have a chat and you can tell me what's been going on.
Sure. We had him in kennels for 2.5 weeks over Christmas.
Yeah.
And when we picked him up, we noticed that whenever he would go from this position to lying down, he would make a noise.
Okay. He makes a grunt. Has there been any coughing?
No.
No.
Is that a bit sore there? Yeah, he's a bit sore. Could we lie you on your side? So when I'm kind of pressed there, that's a bit sore, isn't it, sweetie?
Bucky, no,
Bucky. It's all right, Poppet.
Okay, good boy.
He's a good boy.
Right, okay. I would really find it very difficult to tie return of a mass in the chest back with that kind of grunt. Okay.
Right.
If the tumour was aggressive enough to grow over 2 to 3 months, we probably would have seen it before now on the CT scan in his chest before this. So I think it's unlikely that that grunting noise is caused by that.
Well, you're very, very, very reassuring.
Yeah.
Thank you.
He is painful over the area where the nerves are covered by the muscles from the amputation. And if he's been lying on cold, hard surfaces for a couple of weeks, then it may be that that grunt is just because he's a bit sore in that area. He's gone past the year, which is the average of the mean survival time, so he's beyond that. And we do have some dogs which have 2 or 3 years beyond that.
Sure. Well,
we know that because
we live in
still
hope.
see them. Okay.
I can't thank you enough, as always.
That's all right.
Thank you so
My
much.
pleasure. I love seeing him.
It's been a great day today. I mean, we always come here with a worry, but you know, I think for Tim to say that in his judgment it is the sack, and that he's just spent too long either bouncing on it or lying on it on cold concrete whilst in kennels, you know.
But everything's okay now? Yes.
If ever there's proof it can work, he's sitting here.
Come on then, let's go.
5 months has now passed since Bella began chemotherapy for her life-threatening brain disease. Today, her owner, Diane, has brought her for a different treatment.
Bella deserves everything. Yeah, pampering, nice dinners, absolutely everything. She'd been through an awful lot, and, well, after she nearly died, I thought that was it.
Bella visits Fitzpatrick's regularly for chemo, but she's doing well, and the dose is gradually being reduced.
She's got a few, like you say, thin sort of patches, hasn't she? That's where they should keep shaving her fur off. I know she has more treatment to go, but she's well, and I'm just going to try to remain positive. You look gorgeous. I've got my Bella back. Oh, she's beautiful. Oh, thank you. She looks lovely. Thank you.
Since the operation on all of his legs 5 months ago, it's been a testing time for Cyrus, as well as owners Amin and Minu.
Recovery was really hard for him, for us. You know, you have to always take care of them. We couldn't leave them more than 2 or 3 hours.
Yeah.
Yeah.
They needed round-the-clock attention for 3 months. But you're happy when you actually see what you've done. It paid off. He's happy, he's healthy. Fantastic feeling that you see him out running with Bruce. He's running, he's quick. He goes the same speed as Bruce.
Come here, Bruce!
It's spring, and Hugh and Sarah are taking three-legged Bucklesbury Bear on a special outing, so he can enjoy the exercise he loves.
We spend the majority of our time driving around the countryside.
Looking for beaches for him to swim on and lakes.
The Bucksmobile is his best friend, I think. Come on, there we go. I've got you. Okay?
Oh, my word, Bucky.
This is Pride. That's my boy.
Big dogs can do fantastically well on 3 legs, and the fact that he is embracing every day, swimming, leading an active life, brings so much hope to all of us. When we have our troubles, when we have our tribulations, we can look at him and go, dogs are amazing. Let's get on with life.
I look at him and he inspires me. He brings as much back as we've put out for him, without a doubt.
Hello, monkey. Come on. Hello, sweetie.
I think he is the bravest, bonniest, most beautiful bear in the world.